Well, if you didn't know, April is Testicular Cancer Awareness Month, and the good news is testicular cancer is very treatable with the risk of dying from the cancer, about 1 in 5,000, but it is the most common cancer in men between the ages of 15 and 35.
All right, we're going to dig into this. Joining us today as we thrive with Twin Cities Live to share more about testicular cancer is Dr. Tim Toonen with Minnesota Oncology. Dr. Toonen, nice to have you.
Thanks for having us. Appreciate that.
This is really important. I think getting out of the way the fact that, you know, this is cancer that's in a sensitive area, both literally and figuratively. And so do you find that that's a concern, that like young men are maybe embarrassed if they notice a symptom, or they don't really want to talk about it and they're afraid to kind of bring it up?
Absolutely.
Yeah.
We know that there's a 5-month delay from the onset of symptoms to someone going to a physician or a provider.
No way.
Yeah, so that's one of the things we want to make people or men aware of, is that, hey, it's okay. We need to get this checked out. If it's nothing, we move on. But if it's something, then, because the earlier we deal with this, the better the outcome.
The better. It kind of reminds me of like early days of breast cancer, when it was just like embarrassing to be talking about it. And you see how the narrative has shifted, how it's common conversation. No one's like embarrassed to say the word breast. Like that's what we need to happen with this type of cancer too.
Right, absolutely.
Yeah, and I think especially for men, you know, just when it comes to any ailment, you might feel a pain or a bump or a lump or something, like, it's fine, it'll just go away.
My opposite experience, men I think are like, I have a cold.
No, well,
I'm dead for a week.
Okay, we don't need to talk about colds and flus, that's a whole different thing.
All right.
But we do want to talk about how important it is when you talk about that 5-month little lag period between symptoms and when things actually start to happen. So what are some of the common symptoms one might feel?
Yeah, that's a great question. It's a painless lump in one of the testicles, or sometimes there's heaviness in the scrotum. It's not really acute pain, but it's a lump, a painless lump. So that's the most common symptom.
So there's not going to be like a dull ache or anything. I mean, early on, so much like with women and their breasts, it's probably important for guys just to feel around and just make sure that there's something, like everything's smooth and nothing abnormal.
Yeah, that's a great question. You know, we know that screening's not in part of the testicular cancer screening, but awareness, being aware and say, hey, that's a change. I need to go get this checked out.
Yeah. I would say probably in general, do you think that as someone who treats cancer, if you feel like something is off, you've got to advocate for yourself?
Right.
Yeah.
Absolutely.
Okay, so what are some of the risk factors?
Sure. An undistended testicle at birth, so the testicle doesn't come out of the abdominal cavity. So sometimes people don't know that. Their parents should tell them that. Marijuana use.
Whoa.
Yeah, so there's a 36% increase over 10 years of smoking marijuana. Tobacco use is somewhat less common of a risk factor.
Interesting.
So, yeah.
Something going on there.
I know. I think that's a huge thing with all the cannabis stuff that's going on. How does one diagnose, and then what are the treatment options for everybody?
Sure. The first thing that your physician or provider would do would be order a testicular ultrasound. So looking at the mass, seeing if it's abnormal, and then if that's abnormal, referral to a urologist, and usually plan for surgical removal of the testicle.
Okay.
We were talking earlier about the importance of family planning and sperm banking.
Right.
So that's part of if we suspect that someone might have testicular cancer, we'd refer them for sperm banking.
And that could be any time. I mean, you could be a teenager and you could go, okay,
Correct.
let's make sure that we're planning ahead for what I might want in the future.
Yeah, I mean, the risk factor of infertility with chemotherapy treatment or radiation treatment is about 1 to 40%. So it's a wide range.
Yeah.
But people might want to have that as an option for themselves.
But the good news is, I mean, I think particularly for people who are going, I'm afraid to know, I don't want to even deal with this, it is highly treatable. I mean, this is something that you can go in and really live a very normal life after.
Correct. This is one of medicine's most successful stories.
Yeah.
95% cure rate, especially when it's caught early. Stage 1, confined to the testicle. A lot of times all we do is active surveillance, watch them, tumor markers, scans, exams. If it's stage 2 or 3, then sometimes chemotherapy, or a lot of times chemotherapy or radiation therapy, or sometimes surgical removal of lymph nodes in the abdominal cavity.
Yeah. Well, this is all great information. Thanks so much for stopping by. And,
Thanks for having us.
Guys out there, do a little of your own checking, and if something's abnormal, please check it out.
Definitely. If you want to learn more about testicular cancer treatment and providers, Minnesota Oncology is the Twin Cities' largest and only independent care provider. They have more than 100 cancer care specialists and multiple locations across the metro. The Colon and Rectal Surgery Associates recently joined the practice, so that expands those comprehensive care options. You can learn more at mnoncology.com. We'll be back.